Hello, my name is Frank Clements. I'm a physician assistant in South Georgia and have been a physician assistant for the last 20 years. I'm currently 48 years old and was recently diagnosed with prostate cancer. I decided to put my story out to try to help someone in the decision-making process in regards to prostate cancer treatment. I was diagnosed with prostate cancer in April of 2018. My prostate surface antigen, or PSA, was elevated in 2017, but my primary care physician and I discussed it and decided that we would just monitor it for another year as it was not above the normal limits. In April of 2018, we had it repeated and it had doubled from the year prior. Subsequently, it was seen by my urologist, who did an exam which was normal. This was followed by a free PSA which showed low levels indicating there was a chance of prostate cancer. I then had a prostate biopsy performed. 9 of the 12 biopsies were positive for adenocarcinoma. I was diagnosed with a Gleason 6 tumor at that point in time. The decision on treatment was very cloudy for me, and my urologist really had no recommendations for me except to do some research and decide how I wanted to be treated. Being in the medicine field and having close to 30 years of medical experience, I started performing research and looking at all the options. Obviously, at this point in time, I discovered that there was options of surveillance versus radiation treatment versus proton therapy, and obviously then considering a radical prostatectomy. Each of those had their own scary thoughts and side effects that was concerning to me. I had multiple consultations with each of the treatment options and subsequently decided on a radical prostatectomy. During the process, I discovered Dr. David Samadi at the Lenox Hill Hospital in Manhattan. From day one, I was very comfortable with Dr. Samadi, even though I live in South Georgia. After all the consultations was done, I finally made a decision that the best option for me at 48 was to have a radical prostatectomy because it was my only chance of really being completely cancer-free. I was overly concerned in regards to the side effects of impotence and incontinence with the radical prostatectomy. Dr. Samadi assured me that he could perform the surgery and that I would have a very low chance of having these complications. I subsequently had the radical prostatectomy at the Lenox Hill Hospital, and my experience there was absolutely phenomenal, from the nursing staff to the administration, OR team, and Dr. Samadi himself made me feel comfortable every day. My surgery was performed without any complications. I'm now 6 weeks out from radical prostatectomy, and my PSA level is 0. After the radical prostatectomy was performed, the pathology report came back that it was actually a Gleason 7, with 40% of my prostate being involved. I have nothing but gratitude for Dr. Samadi and his team and their ability to perform a high-level service and make you feel comfortable the entire time. I'm also happy to report that from day one after my catheter was removed, I've had no urinary incontinence symptoms. I've been able to control my urine throughout the day, was back to work in a couple of weeks, seeing patients. I had some restrictions of no lifting, but I was able to return to work pretty rapidly. And in fact, this past weekend, I was able to play 3 rounds of golf, again, with no urinary incontinence at 6 weeks. Also, I've had no problems with impotence, and even early on, at 4 days after the catheter was removed, I was able to achieve an erection and currently am sexually active with no sexual dysfunction. This is without medications. So basically, the decision process came down for me really had to do with the fact that the secondary cancer risk from proton therapy and radiation therapy is low, but is certainly there. And I did not want to have another risk of cancer. The radiation specialist basically said to me, the risk is the same as being put to sleep for surgery, so if you're going to take on the risk of surgery, then you should take on the risk of radiation. I didn't really agree with that, because the risk of the radiation having a secondary cancer subsequently means I've got more risk to have more surgery down the road. Therefore, I think personally that in a healthy individual, a radical prostatectomy is probably the choice, and I would not have anybody other than Dr. David Samadi perform my surgery. Since the surgery, he's been available to me via text, FaceTime. His staff is all awesome. Everybody answers questions and gets back to you in a very timely manner to answer your questions and solve your concerns. I hope this helps. I hope someone out there will benefit from the fact that I'm on the medical side of it, was able to do all the research, and still came to the conclusion that radical prostatectomy was the correct answer, that I have no side effects. My surgery was a great success, and Dr. Samadi's been wonderful. God bless.